I'm going to talk about some natural supplements that have been scientifically proven to lower blood pressure. The first one I'm going to talk about is coenzyme Q10 or CoQ10. CoQ10 is a powerful antioxidant that you find naturally in foods like oily fish, organ meats like liver and kidney, and whole grains. When it comes to blood pressure, CoQ10 can lower the systolic, that's the upper number of your blood pressure reading, by about 17, and the lower diastolic reading by about 10. CoQ10 has lots of other benefits. For example, people who took CoQ10 within 3 days of having a heart attack were much less likely to have another one. And CoQ10 helps to reduce some of the side effects that you may get when you're taking certain medications, like the muscle pain that you may get if you're taking statins. The usual dose of CoQ10 is 30 to 200 milligrams per day, and it's better to take it in the form of soft gels rather than capsules. Seeing as CoQ10 is fat soluble, it's better to take it with a meal that has fat in it. That way it will be absorbed better. It might also be better to take it at night. The blood pressure lowering effects of CoQ10 may actually take up to 12 weeks before you notice them. CoQ10 can interfere with some of the medications that you may be taking on a regular basis. For example, it can interfere with warfarin, which is a blood thinner. It may also affect your blood sugar medication and your blood pressure medicines. Next up is L-arginine, which is an amino acid. Amino acids is what makes up your proteins, and it's found in high protein foods like meat, chicken, dairy, nuts, and seeds. Your body uses arginine to produce nitric oxide, and nitric oxide helps the walls of your arteries to relax, which brings down your blood pressure. Your body's production of nitric oxide naturally goes down as you get older, but this is made even worse by not being active, having diabetes, having high blood pressure, or heart disease. Combining arginine with some of the medicines that are used for erectile dysfunction can actually make them more effective. When it comes to blood pressure, arginine lowers the upper number of your blood pressure by an average of 6 and the lower number by an average of 2. I'm saying average because for some people it might be more and for some people it might be less than that. Arginine may also work better if you combine it with vitamin B6 and vitamin B12. Taking arginine can interfere with some of the medicines you're taking regularly. For example, it can interfere with warfarin and aspirin, diuretics, that's water pills, nitroglycerin, and your high blood pressure medicines. You can take arginine at a dose of 3 to 6 grams a day. Unfortunately, arginine is removed very fast from your body, and that's where the next supplement comes in, which is citrulline. Citrulline is found in the white outer rind of watermelons, and it's converted to arginine gradually in the body. Most studies used 3 to 9 grams of citrulline per day, and you might actually get better results if you combine arginine and citrulline. Next up is vitamin K. Vitamin K is actually a group of vitamins that are found naturally in food. Vitamin K1 is found in leafy green vegetables, okra, asparagus, prunes, and avocados. Vitamin K2 is more potent and longer lasting in the body. You can find vitamin K2 in natto, that's fermented soya beans, eels, sauerkraut, hard cheeses, and organ meats. Vitamin K2 helps the heart to beat better. It makes the walls of your arteries more elastic. It helps to remove some of the calcium that's stored in the walls of your arteries, which allows them to expand and absorb pressure. It also helps to slow down the rate at which calcium is stored in the walls of these arteries. And when you have calcium stored in your arteries, naturally they can't expand the way that they should. Vitamin K2 can also help to reduce insulin resistance, which will also bring down your blood pressure. The most widely used forms of vitamin K2 are the MK4 and the MK7 variations. If you have a lot of side effects with the MK7 form, you may do better with the MK4 variety. The best form to use is the trans version of these vitamins because that's the way that it's found in nature and that's the way that it will be more effective. The suggested dose for vitamin K2 as MK7 is 100 to 200 micrograms a day, and for the MK4 form, it can be up to 45 milligrams per day. Magnesium is a natural mineral found in nuts, in seeds, in legumes, spinach, and salmon. Magnesium helps to bring down inflammation, and it also helps the walls of your arteries to relax, and these two together will help to bring down your blood pressure. Magnesium is usually used at a dose of 240 to 600 milligrams a day, and there are lots of different forms of magnesium that you can buy. The most affordable types of magnesium you can buy are probably going to be magnesium citrate and magnesium chloride, but these have a higher chance of causing diarrhea. The best all-round magnesium is probably magnesium glycinate because it's quite affordable and it tends to have few side effects. Magnesium taurate may be better for the heart and blood vessels, and magnesium threonate, which is probably the most expensive, is sometimes called the brain magnesium. Next is garlic. Garlic contains allicin, which helps to reduce inflammation and also helps your blood vessels to relax, which again will reduce your blood pressure. Aged garlic has more antioxidants and phytonutrients than fresh garlic does, and it also has fewer side effects. Studies used 1.2 grams of aged garlic, and they used this for about 12 weeks to get the best results. And aged garlic may be more effective if you combine it with vitamin B9 and B12. If you use fresh garlic, crush it and leave it for 15 minutes before taking it, and this will make it more effective. Some of the side effects of taking too much fresh garlic include blurred vision, confusion, excessive sweating, tightness in the chest, and difficulty in breathing. It can also enhance the action of blood thinning medicines. Next up is nattokinase, which is an enzyme that's found in natto, which I mentioned before, which is fermented soybean. Nattokinase helps to dissolve blood clots. It also helps the blood to flow more freely. It can lower blood pressure, lower cholesterol, and protects the brain. If you're taking certain medications, again, you have to be careful when you're taking nattokinase. These include blood thinners, painkillers like ibuprofen or ibuprofen, and medicines for high blood pressure. Some of the side effects of nattokinase include bleeding gums, and then if you already have a clot, the clot may actually dislodge and go somewhere else in the body where it causes problems. Nattokinase is usually used at a dose of 100 to 200 milligrams a day, which is the equivalent of 2,000 to 4,000 fibrinolytic units a day. Omega-3 fatty acids have a lot of health benefits, and they can slightly lower your blood pressure, especially if you're over 45. You can find them naturally in fatty fish like mackerel, tuna, herring, salmon, sardines. You can also find them in algae, which is the original source of the omega-3s that you find in the fish. You can find them in flax seeds, chia seeds, and walnuts. The recommended dose is 2 to 3 grams per day, and you don't necessarily get better results by going higher than this. Instead, you're more likely to have side effects, which can include excessive bleeding and abnormal heartbeats. You should already be eating 2 to 3 servings of fatty fish a week just to maintain your general health, but this isn't going to be enough to bring down your blood pressure if it's already high. But you can actually lower your blood pressure naturally and permanently without any supplements at all, and I'll show you how to do that in the next video.